Hello all, very good morning. So far we have been discussing regarding the health assessment. So in health assessment, we are discussing the health assessment which is done according to the age. In previous class, I have said you regarding the health assessment of an infant. Now we are going to discuss the health assessment which is done on the toddler and preschool child. So here, if you see the toddler or preschool, here the age group is like 2 to 4 years. So here, if you see in this period, the rapid growth and development takes place. And it is also period for full health hazards in a child's life. So with intense growth and development taking place, there are more chances for the health hazards that can be occurred. So here his or her vaccination is also completed during the preschool and this toddler age period. So during this age, the child can suffer from the dehydration, diarrhea, malnutrition and other infectious disease. So it is very essential and it is very important to perform the health assessments on the toddler and preschool going child. So what is the age group here? Mainly the 2 to 4 years age group. So here in this group, as we are discussing, there will be rapid growth and there will be rapid development that is going to take place. So there are more chances for the full health hazards here. So what are all the components that were included in the health assessments of the children belonging to this age group 2 to 4 years, means toddler and preschool, means mainly surveillance of the school children. It is very important here. Mainly we are going to get the past medical history, we are going to get the personal and family history of the child. So whenever you are getting the personal and family history of the child, if she is having any kind of risk factors for developing any kind of diseases or not, we will able to check here. And we are going to perform the health checkups which is related to the growth and development of the child. We will check the immunization status of the child. We will check the nutritional level of the child and his eating habits. What are all the dietary patterns? And we will check the present condition of the child's health and his major health problems. And we will perform the physical examination child and review of all systems of his hair or her body. So these are some of the points that should be kept during the health assessment of a child belonging to the age group of 2 to 4 years. So here, if you see health assessment of the school going and preschool and school going child here. So here, it is very important to get this school health service. So along with the community health nurse, physician and teachers, these are also responsible to do the assessment here. And if you see the health assessment of the school going children, we are going to perform the following components whenever you are doing an assessment here. So we are going to perform the periodic medical examination. So in this periodic medical examination, we are going to perform the checkup at the time of admission. We are going to perform the daily morning inspection or examination, and we are going to conduct the checkups for every fourth child for every 4th year, and we are going to check up the you are going to perform the checkups whenever the child is leaving the school, and review of school health records should be maintained properly, and periodic health checkups, they can be conducted before and after the completion of 4 years or even more frequently. Then you can have the data of the child. We are going to perform the checkups at the school admission. So whenever you are performing the school admission, whenever your child is getting admitted into the school, you should perform the health assessment, so that if the child is having any problems, you can get known whether the developmental milestones are according to the age or not, whether they are having any kind of mental instability, whether they are cognitive, whether they are having any kind of cognitive impairment or not. So all these things we will check in this during this health assessment here. Nextly, we are going to measure the height and weight, and we are even going to perform the dental checkup. We are going to perform the eye checkup, whether the child is having any kind of eye problems or not. If you find out the eye problems, we can go for the vitamin A prophylaxis, or you can go for the other treatment models which is related to the eyes here. And we can check the speech and hearing checkup. So with the speech and hearing checkup, whether they are having any kind of ear abnormalities, whether they can give us the syllable words properly or not, whether he is able to perform, whether he is able to pronounce the words correct or not, we can check here. And nextly, we are going to conduct the routine test of urine and blood here. So in urine, whether he is having any kind of bacterial infections or not. In blood, we are going to check the HB of the baby, and we are going to check the normal CBP count of the baby. So if there is any kind of problems detected, we can go for the treatment there. And we are going to do we are going to find out the known to unknown diseases or disorder that the child is suffering from. So whenever you are performing the health assessment, if the child is really having any kind of disease, so at that time mainly we are going to get the data. So simply whenever you are performing the health assessment, if the child is having any kind of disease, you can get known over there. Nextly, we are going to perform the nutritional assessment here. So nutritional assessment, it includes what is the food the child is getting at home and what are all the supplementary meals given at the school. So whenever you are performing a nutritional assessment, so during this age, most of the children, they are suffering with the nutritional deficiencies. So whenever a child is not getting proper nutrition, he might be obese or he might be thin or he might be resulting in any kind of nutritional disorders. There might be protein allergy malnutrition. There might be there might be fat deposits will be very low, or sometimes the patient will be very weak and very thin. So all these aspects can be done through this nutritional assessment here. And we are going to perform the daily morning examination. So here, whenever you are doing the daily morning examination of the child, it is mainly done by the teachers. So here, the teachers who are performing, they should be trained and they should be having knowledge in the diagnosing the illness, and they should provide the routine treatment to the children. And during the daily examination, it is your responsibility to keep an eye on the child, whether he is having any kind of cold, cough, headache or skin diseases or any kind of other infections or any kind of accidental wounds that are present on the child there. So this is the daily morning routine examination which is done in the schools. Nextly, we are going to check the personal and family history of the children. So here history is collected through the parent teacher or parent community health nurse here. So teacher or the community health nurse plays an important role here. So meetings are held at the time of admission in the school and later on time to time. And whenever you're performing the desirable health assessments, you can get the personal history of the child and as well as you can get the family history of the child. Based on that, the child can be treated in a proper manner. And it is your responsibility to take the past medical history here. So past medical history of the child, it can be produced from the child or the parents. So here the community health nurse, the doctors and the teachers and the parents, so these persons, they are sharing the joint responsibility in the health assessment of the school going children. So as a community health nurse, it is your responsibility to perform the health assessment and school going children on the toddlers and school going children. So because during this age the rapid development will be taking place and there is more chances for getting the health hazards in them. So during this age only we are going to mainly stop the immunization. So we should focus on the what are all the nutritional abilities of the patient. We should focus what are all the health status of the patient, what are all the health hazards that are involved in the patient. So whenever you're performing the assessment on a regular basis, so we are able to find out the causes of the disease and we can treat the disease in an appropriate manner. So this is the health assessment techniques which are performed in the toddler and school going children, mainly the age group of 2 to 4 years. So this is the health assessment. So in next class I am going to discuss the other age related health assessments. So with this I would like to continue complete the topic here. So if you have any queries, you can drop them in the comment box, and if you like the content, please like, share and subscribe the channel. Thank you so much. Thanks for watching.